Effect of smoking on the human body.
Escape the normal control mechanisms, and they continue to grow, and they may spread. That's what we call cancer.
Those cells together, we would call that a tumor. Specifically, cancer is a malignant tumor, and we call it malignant because not only can it invade into adjacent organs, but unfortunately a cancer can spread to other tissues, and that can be life-threatening.
Cancer can actually occur anywhere in the body because there are cells everywhere in the body. In women, one of the most common cancers, of course, is breast cancer, and in men, prostate cancer. And in both men and women, lung cancer and colon cancer are common cancers.
It's important to understand that the cancer that occurs in one individual is very different than the cancer that occurs in another, just like those individuals are different. So a lung tumor in one person will be very different from a lung tumor in another person.
Once the diagnosis of cancer is made, of course, the next obvious question is, what do you do? There are several things that are really relevant. The stage of the cancer, which is information about where is the cancer. Do you say it's a particular kind of cancer? How much cancer is present? Has it spread? Is it in lymph nodes? Has it spread to other organs of the body?
Cancer treatment actually is very complex. And part of the reason is because cancer is this constellation of over 200 different diseases. They have common characteristics, but they're all very different from each other. In addition to that, the cancer itself is not homogeneous. There may be 3 or 4 or 5 or 6 different slight variations in the cancer cells that are there. People ask, why? Why does my cancer not go away? It shrunk by 70%. What's wrong with the other 30%? Well, it's probably a different subtype of that cancer, which is going to require a different kind of treatment.
There are 3 primary therapies for cancer: surgery, radiation, and chemotherapy. Surgery works by directly removing the tumor. The radiation therapy provides X-rays to kill individual cells, and the chemotherapy provides chemicals that can kill those individual cells, but they have side effects.
The best therapies that we can produce really are the result of optimizing the amount of tumor that we can kill by any treatment and minimizing the amount of damage that we cause to the normal cells that would be affected by that treatment.
At Cancer Treatment Centers of America, we have a very robust integrative oncology program. Integrative oncology is taking those conventional oncology treatments and integrating those
factor in how long we live.
Heart disease is a big term referring to any disease of the heart.
Now, the most common cause is coronary artery disease.
And that refers to a buildup of plaque in the arteries. Over time, it can lead to narrowing of arteries and risk of a heart attack.
A heart attack is when a part of the heart muscle dies because it is deprived of blood flow or oxygen. Or it can be due to the heart having to work really, really hard that outstrips the oxygen supply.
Most coronary artery disease is preventable, says Dr.
When
Hayes.
the blood
If you're
flow
smoking,
in
stop.
part of your brain is blocked.
Get up and start.
After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via 2 major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain.